Hello there, this is Dr. Mintz. This is a CT of the cervical spine in a 32-year-old male with a history of moped accident. Here you can see the ET tube and feeding tube in place, and you should always double check to make sure that they are in the proper location. Here's the thyroid cartilage. This is the level of the glottis, the vocal cords. And let's look at the cervical spine now. Actually, first you see this little air bubble here. That's in the subclavian vein. That's normal because when they start an IV, some air will get in the line, so it's normal to see a little air bubble or two or three in the subclavian vein. So here you see both lung apices, and I'll go right to the lung windows, which shows a pneumothorax. Always important to look at the lung windows on the cervical spine in patients who have had trauma or any other history too, but particularly trauma. And you can see some soft tissue opacification of the apex of the lung there, which is probably, I would guess, pulmonary contusion, although it could be related to atelectasis secondary to the pneumothorax. Okay, so now as we move superiorly from the thoracic spine, you see an abnormality right here. That's in the C7 vertebra. You can see there's a little offset here, a little linear lucency through the bone there, and that's a fracture of C7 lateral mass. And then we'll go more superiorly from there. And as we get toward the occiput, we see some fractures here. Now, some of this is related to the C1 vertebra, and some is related to the occiput, the occipital condyle itself. And we can see that more clearly on coronal images. So here we have a coronal image showing clearly that there is a fracture of the left occipital condyle, and it's mildly displaced. And you see a little fracture off C1 as well, and it's bigger than it appears on that coronal image because it wraps around a little bit. I think we could see that and appreciate it more clearly here. Here you can see that it's larger than it appeared on the coronal image. So you have a C1 chip fracture and you have a fracture of the occipital condyle, all consistent with axial loading, probably with a tilt of the head. Had axial loading, and most of the pressure went down on the left side, fractured this articulation at the junction of the occipital condyle and C1, with relatively minor components of fracture at C1 and at the occipital condyle, but in that same path, in that same weight-bearing cylinder, if you will, there is a fracture of C7, and this is a fracture of the pars interarticularis. So here you have the articular facets of C7. This is the lateral mass, this trapezoid. Here is a lateral mass. This is a lateral mass. And so this is a fracture of the pars interarticularis, or a pars fracture at C7. Looking at the rest of the cervical spine, the vertebrae are well aligned. Here you see the foramen magnum. This is the occiput here. And here you can see the C1 and C2 articulation. Okay, going to the axial images here, which used to be all that we had. Here you can actually appreciate much more clearly the complexity of the fracture at the occiput C1 level, with fragments of the occipital condyle and fractures of the C1 ring, the lateral mass, left lateral mass of C1. And here's the odontoid. Looking at the rest of the vertebra, everything else appears to be okay. Here's the vertebral foramen, where the vertebral arteries run. Here you have the fracture at C7, a little more clearly delineated on this axial view, and you can see how it extends through the C7 lateral mass area and also into the lamina of C7 on the left. This little cleavage here is actually just an artifact of the projection of the C7 and C6 lamina in very close proximity to one another. So here you can see there's one lamina, here's the other. Let's go back to the sagittal. Mastoid air cells, the hyoid bone, thyroid cartilage, partially calcified, okay. So bottom line impression here is that this is a traumatic fracture of the occipital condyle and C1 lateral mass on the left due to axial loading. Patient probably had the head tilted a little bit to the left, which directed the forces onto the left column of the cervical spine, including the occiput and C1 lateral mass, as well as a C7 pars interarticularis fracture.